Ever since I was in my 20s, I was told by the dentist every time I went in, you're in for a mouthful of crowns when you get older. And my teeth were just disintegrating from a very young age. And by my late 40s, 50s, I was having fillings on top of fillings. Dr. Miller said that I should consider getting the whole mouth job done at one time rather than piecemealing it out.
So for Bill's case, he came in as a patient for a routine cleaning. He had a bunch of old fillings and restorations that were breaking down. He wanted a solution so that he could eat and chew without, a tooth breaking off here or a tooth breaking off there. And I sat down and showed him pictures of all the cracks in the teeth, and we were able to accomplish two goals, and that was to restore him to function so that he didn't have to worry about his teeth breaking off anymore when he's eating. And we were also able to give him a smile that he's never had before.
You need to bite the bullet and get this done. The problem is not going to go away, it's going to get worse, and I have great confidence that I'm done with that trauma.
After the procedure, Bill comes in and he's got his fresh haircut. He trimmed his beard. He kind of looks like a whole new person, and that I think a lot of it had to do with that new bright smile he had, giving him that confidence back.